4 years ago, I started an investigation. I wanted to find out why every year at renewal time, my company faces double-digit increases in healthcare premiums.
Let's consider healthcare expenditures at MCS, where I am CEO. In 2018, a family plan cost over $27,000 a year. That's $13.50 an hour for one employee with a family. MCS and its employees spent $2.6 million for health care coverage. That's 22% of payroll in 2018. 155 million Americans receive health care coverage through commercial insurance negotiated by their employers. Another 20 million Americans buy commercial insurance on their own, and Americans pay twice as much for health care compared to the rest of the world. The result is a huge waste of money and also poor population health. Each year, 600,000 Americans file for personal bankruptcy due to medical bills, most of them having some form of insurance. The system is clearly beyond the economic tipping point. How can we get healthcare on the right track, providing comprehensive benefits to all while at the same time reducing cost? There's a simple solution. Its fix is conceptually simple. We adopt Medicare as the insurer for all Americans. We simplify, as other countries have done, the administration of the system by eliminating the expensive middlemen like insurance companies and pharmacy benefit managers that cost us dearly but add little value. We negotiate reasonable prices available internationally for drugs and devices and for medical services under Medicare. We implement a public financing plan that fills in the financial gap created by ending our reliance on insurance companies. To administer MCS's plan, our insurance company takes 17 cents of every premium dollar for overhead. Traditional Medicare takes only 2 cents of each dollar to administer its programs. That's 2 cents versus 17 cents. In addition to their own overhead waste, commercial insurers also cause massive administrative waste at the provider level. Running a hospital in the United States is a bureaucratic nightmare. Many hospitals have one billing person for each bed to handle complex insurance requirements. Doctors and nurses waste hours negotiating with insurers on which treatments are covered and why they are needed. We can save 7 cents of each premium dollar on provider administration with Medicare for All. We all know that pharmaceutical prices in the United States are out of control. We have employees on medications that cost more than their annual salaries. Americans on average pay twice as much for drugs compared to other advanced countries. Medicare for All will establish a regulatory framework to bring down prices to international levels, and that will save 6 cents of each premium dollar we now pay at MCS. U.S. hospitals have regional monopoly pricing power over commercial insurance companies. Medicare does a better job controlling cost by negotiating lower prices for hospital and doctor services. The Commonwealth of Pennsylvania publishes an annual report on hospital economics. It shows that a day in a Pennsylvania hospital under Medicare costs half the amount paid by commercial insurers. Looking at hospital payments across the country, the Congressional Budget Office had similar findings. When we add up all the savings from reducing waste and lowering cost, 41 cents of every MCS premium dollar can be saved with Medicare for All. Our goal is more than just a reduction in cost. The billions of dollars in savings will finance an expansion of coverage to all Americans. As we end our current system's reliance on high insurance premiums, we will use less expensive Medicare payroll deductions to fill the financial gap. Medicare for All will be a tremendous savings for my company and particularly to its hourly employees. For the vast majority of our employees, take-home pay will increase dramatically as premium sharing declines. Overall, MCS's healthcare expense was 22% of payroll in 2018. That's 22% versus the projected 8.2% as a payroll deduction that Dr. Gerald Friedman projects in his plan to finance Medicare for All. Dr. Gerald Friedman is highly regarded for his economic impact studies on single payer for individual states. He has produced a detailed national model demonstrating how Medicare for All can be publicly financed.